How anxiety affects the body. Anxiety is probably the most common psychiatric symptom. Anxiety can be within the normal range or abnormally intense. Normal anxiety is usually referred to as fear. For example, you have an important presentation to give and you're anxious about how well it's going to go. Abnormal anxiety is either much more intense than normal or occurs in a situation where one typically wouldn't expect it, like driving a car. Anxiety essentially channels in 5 ways, like tree branches. How the anxiety channels in your body is correlated highly with one's capacity to cope with stress. By the way, the information I'm about to give is based on the groundbreaking research by Dr. Habib Davanloo, a professor of psychiatry at McGill University. The healthiest channel for anxiety is exclusively psychological. That is, you're anxious about a situation and you're worried, but there's no physical component to it. Another healthy channel for anxiety is via the voluntary skeletal muscles. For example, you'll have some neck and shoulder tension. This is a healthy channel for anxiety because it's close to the surface of your conscious mind and therefore easier to resolve. Also, no major physical problem results from muscle tension. A slightly less healthy channel for the anxiety is via the autonomic nervous system. This is the involuntary nervous system that controls the heart, the gastrointestinal tract, etc. Thus, when the anxiety channels in this way, you experience physical symptoms of a different nature, such as a rapid heartbeat or churning in your stomach. However, there are 2 other channels for anxiety that are more problematic. One channels into the autonomic nervous system just as before, but it's far more intense, and the intense anxiety then causes objective pathology to the internal organs. For example, the gastrointestinal tract might develop a serious illness such as ulcerative colitis. The most problematic channel for anxiety is cognitive disruption. This can cause someone to lose their train of thought, faint, or even become paranoid. When this channel is active, it usually means that the other channels are either flooded or not working properly. There are medications that are effective in ameliorating anxiety. There are psychotherapies that help reduce anxiety or even eliminate it. For example, the technique of intensive short-term dynamic psychotherapy created by Dr. Davanloo can actually restructure the way the anxiety channels within your body so that it channels into the more adaptive ways.